So this talk is entitled The Power of Upper Cervical, and it's become quite popular recently among dentists and dental therapists because more and more people are starting to cotton on to the fact that there's more to the head and face than just the front bits. There are the back bits, which involve brain and upper spine and neck, and all of these things can contribute to TMJ problems and teeth problems. And so the purpose of this talk is to cover the overlapping neurology of TMJ, brainstem, and cervical spine. My name is Neil Bossinger, and I practice in Auckland. Something happening here with my screen. That's good. I practice in Auckland, New Zealand. And principally, I'm an upper cervical chiropractor, but moreover than that, I practice what's called functional neurology. And functional neurology, what that means is basically the difference between going to a medical neurologist and a functional neurologist is that a medical neurologist would do all the tests and measures and find out what's going on, but functionally, something actually needs to be done, and that's rubber meets road. That's hands-on. That's actually doing something with the nervous system and getting it working again. One of the tools that we use is what's called Upper Cervical Specific, and this picture here depicts one of the tables. The table in the middle there. That's a special table for doing very particular corrections to the upper neck, because as I'm going to outline, it's a very important area of the body. It requires a unique understanding of what's happening and how it relates to the nervous system, and requires, as it says in the title, specificity in corrections and making people better. Now, the functional aspect of neurology implies that, say people have health issues and they go for x-rays or they go for MRIs or they go for blood tests, and all these things, all these tests come back clear, as in there's nothing to find, but the individual there's still problems, they're still unhealthy, they're still in pain, but no one is finding anything. There's still a problem. There's still some aspect of unwellness with that individual, and it comes down to how the nervous system is actually firing and how collectively it's working as a whole, and that individual's experience of life is being greatly diminished because it's not working. And so my job is to check the person out from tip to toe and see how all these things are related to each other, all the problems that are related to each other, how the different areas of the nervous system of the body are interconnected, and figure out a way to make the nervous system work better. And one of the tools that we use is the spine. And we're obviously not going to cut someone open and do brain surgery. There has to be a more convenient or less invasive way to create changes in the nervous system, and so we use the spine. And we're taught as children growing up to look after our teeth. It's embedded in our understanding that you need to start going to the dentist as soon as you can to make sure your teeth are growing properly, and make sure that you brush your teeth every day, because you're looking at it in the mirror every morning and every evening, hopefully twice a day, and seeing whether they're crooked or shiny or dirty or chipped, or what state the teeth are in. But very few people acknowledge what's happening with the control system, which is your spine, and the reason for that is behind you. And not a lot of people think about their spine because they don't see it every day. They're only really alerted to the fact that if there's a problem, they're alerted to that fact by pain, and pain is not always a good measure of whether there's a problem in the body or not, because you can have pain without illness and illness without pain. For example, high blood pressure, diabetes, cancer, a lot of these problems which can be neurologically mediated, problems in the immune system, don't always have pain, and it's not a good indication of whether someone is healthy or not. And so part of the assessments in figuring out what is wrong with an individual is to see what their level of function is and how do you bring that level of function back up to speed and get the person well again. And the brain and the spinal cord and the brainstem and the upper cervical spine and all these things we're going to be talking about are critical in how a person works and what we need to do to get them well. This is part of what I'm doing my master's in at the moment. I went back to uni this year after quite a few years in practice to further my education, based around things that I enjoy, which is the autonomic nervous system. Most people don't even know they have an autonomic nervous system, and every person, every living individual has one. It's that part of your nervous system that controls all the natural functions in your body. Organs, glands, blood vessels, hormones, immune system, temperature, how your pupils dilate or constrict, or how your blood vessels constrict or dilate, and all these things are controlled beneath your conscious level of awareness, and it's done automatically by your nervous system. That's another term we use for the autonomic nervous system, is the automatic nervous system. And when that starts to break down, people experience a whole raft of problems, and it is not necessarily based in pain either. So pain can be very misleading sometimes, and part of what I'm including in the Masters is chronic pain as a disorder, because of that distinction between pain and illness not always being related. Sometimes chronic pain can become a disorder in itself. The easiest example in understanding that is phantom limb pain. A person loses a limb and they still feel like they need to scratch the elbow, or their foot feels like it's swelling up, or they may feel pain in that area where the limb no longer exists. And what that means is that the representation of that limb still fully exists in the brain, and they can experience pain in that area because the problem is in the brain, and our entire body is represented in the brain. And so it's really important from a holistic point of view to understand how all the different areas of the nervous system and the body are connected and interrelated. And so this is part of what I'm studying. And the intervention we happen to be using for this particular study that we're doing is mindfulness, which is basically bringing in awareness to where your body is at in the present moment. And that's engaging a lot of cortical or front brain areas, and how the activity of the front brain and your conscious level of awareness changes the autonomic nervous system, changes level of pain, and changes how your nervous system works. Because in the mode of trying to fix people, everyone's trying to fix people, whether it's teeth or bodies or muscles or whatever it is. It's not a Lego set. People are forgetting that or practitioners forget that there's a person inside there that has feelings about how they feel, and that can mess things up sometimes, especially when you start dealing in dysmorphic problems, or how people perceive themselves, or addictive personalities, or ADD, or OCD, or those sort of things. They all influence how the nervous system works. So I'm going to try and cover a broad spectrum of analysis and methodologies to correct all these different problems that we see in practice. But the purpose of today's talk is to cover some elements that are pertinent to dentists and dental therapists, and some problems that you guys might see in practice as it relates to referral to TMJ, or from TMJ to the teeth, head, neck, eyes. Basically how the front is connected to the back. So the front half of the head is intimately connected to the back half of the head through neurology, through the spine, and so we're gonna cover a few of those different areas. And just if you have learnt about it before, it's going to be a reminder. If you haven't learnt about it, it's going to be something new to take back to work. And even if you don't do anything with this information, it's really important to have an understanding of these things in the back of your mind, so that if you see particular problems that start becoming quite hairy, you know that it might warrant a referral to someone else who might be able to deal with it. So coming back to this first slide, a sect in East India refers to this image or this area as the mouth of God. And the shiny white things in the front there of this x-ray are the teeth. I don't have a lot to do with that. That's what dentists specialize in. But it's called an AP open mouth. You might know of that particular kind of x-ray. And it just gives a clean shot of atlas, which is this image through here, the shadow through here, and the lateral masses on each side, and of axis. This is the dens, and this is the body of C2. And atlas and axis collectively form the mouth of God. And why it's so important and why they call it such is because it wraps around the brainstem. And your brainstem is the main fuse box for the whole body. Your brainstem is the gateway between the brain and the body. And if there's issues around little misalignments, or if there's neurological problems associated with C1, C2, or brainstem, a person can experience a whole raft of different symptoms throughout the body. And we'll be covering a few of those as we go. Now, I gave this presentation to the dentists of New Zealand at the Dental Expo earlier this year in May, and but this is a news story that's come into my office recently, and why I've added it in today is because it clearly demonstrates the power of upper cervical, and why I've entitled this talk "The Power of Upper Cervical" is because the changes that the upper cervical spine being corrected properly, or basically having your head on straight, can create in a person are profound, and I see it in practice all the time. But every now and then I get a story like this which can easily keep me fired up and juiced up for 6 months to a year without doing anything motivational, any jacuzzi experience, because for example, this story, it's a life changer for this boy. And he had quite a big fall off a horse. Strangely enough, the mum actually caught it on video, and this is just a snippet of the video, which hopefully will be a case of the month. Each month I put a case up on my website illustrating someone's fantastical story. And so this was a video of him riding around, and as he took this jump, he came off his horse, and the video only stopped at this very last image because Mum must have obviously dropped the camera and run over to him, so we didn't get impact, but you can imagine what's happening there. He's about to hit his head on the ground. And so what happened from there is he started developing what's called Dysautonomia, which means his autonomic nervous system, which controls all the natural functions in your body, started shutting down. And your autonomic nervous system begins in the brainstem and extends down through the rest of the body to control all these natural functions, and it's part of why the upper cervical spine is so important in healthcare. He immediately, well, over a 5-month period actually, because not everything is instantaneous like an on-off switch, but over time he started developing this raft of problems all related to his autonomic nervous system. So he started vomiting every single day. He got instantaneous asthma, where he had no asthma before, and he was being medicated for the vomiting. He was being medicated for the asthma. He was on preventatives. He was taking Ventolin, all these things. He became extremely photosensitive because a lot of the connections into how your eyes work are related to your brainstem. His parasympathetic nervous system, which is a part of the autonomic nervous system, was running riot, and so whenever I shone, he was photosensitive to begin with, sensitivity to light, and when I shone the light in his eyes, he'd start tearing immediately, so lacrimation wasn't working properly. He developed instantaneous acne. His whole face and back had broken out because skin is controlled by the autonomic nervous system, by the central nervous system as a whole, and so if that runs amok, then there's going to be problems with the skin. An easy example for the everyday person is when you get stressed out, you break out. I had a constant headache. That would happen if you land on your head falling off a horse. And temperature fluctuations, so hot, cold, sweating, cold, clammy, just not really maintaining normal environmental changes as it should be. And so he developed all these problems over 5 months, and I ran through all my checks and measures and balances, and we worked our way up to the point where I had given, it was the day to give him his first specific correction, and we decided to adjust Atlas that day, and he received his correction, and from that day forward, and this is why he's been the miracle of the year so far, is that instantly he stopped vomiting, almost instantly his breathing normalized and his asthma resolved. Light no longer bothered him. He didn't tear anymore when I shone the light in his eyes. His skin has started to clear up over the last few months. His headache went away, and his hands normalized in temperature. A lot of people might refer to that as Raynaud's syndrome. However, sometimes it's actually just a dysfunction in the autonomic nervous system. And so all these things changed immediately following one upper cervical correction. And I test it like that sometimes by only doing one thing, not giving people the flying 7 in the hope that something will work. Doing one correction and seeing what happens. And all these things came right, and he's been medication-free since that day. Cervical Specific is a strict discipline within chiropractic. It's based on technical analysis. It's not have-a-go chiropractic. It's not people randomly taking weekend courses and manipulation. It's built on top of a 5-year degree. And the analogy that I use in practice is I own a Mazda, right? And so I choose to take my Mazda to a Mazda specialist because they have understanding of the electronics and everything that goes along with making a Mazda work properly, versus just taking my car to the local mechanic who does a bit of everything. Understanding the upper cervical spine and how the body works in general requires quite a deep specificity of understanding to make the appropriate corrections and to get results for people. So when people are engaging in health and wellness activities, because they don't study this sort of stuff day in and day out, they kind of go on hearsay or things they read on the web or what other people are doing or what's in vogue at the time. And people can spend a lot of time on miscellaneous adventures in health that don't really add up to anything specific in getting someone well. Taking your problems to the right person who knows what to do can really shorten the amount of time to get well quite dramatically and increase the results exponentially. It's quite important that you're seeing the right person for the right problems. And so upper cervical is about understanding what's happening with the upper neck. And it requires unique understanding around the anatomy of atlas and axis. It requires deep understanding of the relationship of skull to atlas, atlas to axis. These are the top two bones in the neck. Being an upper cervical chiropractor, or chiropractor in general really, requires a good understanding of the nervous system and the neurology of brain and cerebellum. Cerebellum is the little brain that's at the back of the head, and that's responsible for maintaining balance and coordination. We also know now that it fine-tunes emotion. It's very susceptible to alcohol or any toxicity really. So that's the testing that the police do on the side of the road. When they're making you walk the white line, they're doing cerebellar testing. And the cerebellum influences how the muscles work, how the spine works, so one needs to understand aspects around cerebellar function. Neurology of the brainstem. The brainstem is pivotal to upper cervical practice. The brainstem is the main fuse box for the house, your house being your body, and if that fuse box blows, then there's going to be a lot of problems throughout the system. And we'll talk about how a lot of upper cervical problems and jaw problems and facial problems feed back into the brainstem and can create a lot of problems or pain for people. The practitioner needs to have an understanding of the neurological associations between all these different things and basically how the entire body works. So it's a lot of education, 5 to 7 years and a lot of practice in getting things, getting techniques right and understanding what you're looking at. I saw a lady just yesterday, in fact, who was saying to me that she's getting a bit sick of going to her doctor, who doesn't even look at her anymore because everything's become so technologically based that they don't. Very few people even touch their patients anymore, and it's you know, when trying to solve people's problems, it's a hands-on job, and it needs a lot of practice in understanding how all these things work. Atlas and axis. Why it's so important is because out of all the vertebrae in the spine, these two are the most unique. They have the most unique alignment systems. They have unique shapes, and interestingly enough, there's no discs between C1 and C2 and between skull and atlas. Everyone's aware that you have discs in your spine. They're like little shock absorbers that add in for shock and axial pressure, and when people have when people supposedly slip a disc, which is not entirely true, but when they blow a disc, that creates a lot of back pain. But in the upper spine, there are no discs, and the only thing that's holding this all together are muscles and ligaments. And without muscles and ligaments, you can spin your head right round, and obviously that's not going to happen because it's well controlled by the brain and the muscles. However, the alignment allows for the most movement in the upper cervical spine. 50% of rotation of the head in the upper cervical in the cervical spine is in the upper part, and there are no locking joints, so that's why we can move our head around as much as we can, but it comes at a price with all that movement, because sometimes that can cause aberrant or abnormal feedback into the nervous system because there's so much movement. Sometimes can cause little misalignments, and we'll talk about that more as we go, and can create a raft of problems feeding back into the nervous system. It has the richest array of neurological input. The easiest way to understand that is your nervous system gets more important the higher up you go. So starting from the spinal cord, moving up towards the head. If you have an injury low down, you might become a paraplegic. If you have an injury higher up in the neck, kind of like I often use the Christopher Reeves analogy, Superman, who also fell off his horse, but he fractured C2, as you can see on this image here. He fractured C2, but moreover than that, it actually severed his part of his spinal cord that actually controls the rest of his body moving down. And so if you have an injury higher up in the spinal cord, can create quadriplegia. And then obviously if people sustain brain injury, then that may be game over. So the higher up the spinal cord, the higher up the spine you go, the more important the information feeding into the nervous system becomes. And so beyond just bones, we start to understand why the upper cervical spine is so important in getting people well, and why certain health problems might come about neurologically. And using atlas and axis as keys, or you know, like ignition keys to get the vehicle moving again. And it is the gateway between the brain and the body, between skull and the body. Atlas is the gateway, and so it's really important on a very, very simplistic level to keep your head on straight. So I mentioned that 50% of the motion of the cervical spine exists in the upper cervical spine, but because of the unique alignment system that allows massive amounts of movement, it's also important for people to understand that the upper cervical spine always moves in coupled motions. There's never an isolated movement of one vertebra or the other, or the skull or atlas or axis. They always move together. And why I decided to put this in is because it can be relevant to dentists who have the spine, the neck in extension, or the head in extension. And when the head is in extension, all the posterior elements, all the bits and pieces at the back of the spine and skull here, and the neurology which sits around this area, they all get compressed in extension. And when the head is flexed forward, then all these elements open up here. Why that's important is because there's a lot of neurology at the back of the spine. As it pertains to, say, headaches, for example, sometimes there's a lot of causes for headaches, but some headaches might be cervicogenic in origin, which means coming from the neck. And these little highlighted yellow bits here are the C2 nerve roots. This here is C1, this is C2, and these are the C2 nerve roots. Why they're relevant in this situation is because the C2 nerve roots extend up and around to the side of the head and into the temple, and sometimes when people get so-called neck headaches, they can experience a headache behind the eye, on the temple, and can sometimes refer to the jaw or just behind the ear. And so if the head is an extension, these elements here, the atlas, the posterior arches here, and the C2 body can compress each other and can really affect the way that C2 nerve root is firing and can create a lot of problems for people. As a brief moment of interest in history, the man on the right there with the hat is B.J. Palmer. He was the developer of chiropractic. His father invented chiropractic in 1895, and B.J. went on to develop Upper Cervical Specific, most prominently throughout the 30s, 40s, and 50s. And he used to travel quite extensively, and this is a picture of him in India. And he'd often demonstrate the power of chiropractic, the power of upper cervical, by adjusting elephants. And he'd take elephants through the streets. Apparently he got fined a couple of times because the elephants were defecating in the streets, and that wasn't allowed. However, he used to, I think he used to take a mallet or something, because as you can see there on the left, that's an atlas. This is an atlas of an elephant, which is remarkably similar to the shape of a human atlas. And he used to take a mallet or something and try and adjust the atlas of the elephant and demonstrate how upper cervical would keep even animals well. It wasn't related just to cognition or how you feel or perceive or anything like that in any living organism. If the neurology was working properly, then everyone had the potential, any living organism had the potential to be well. And so that was about mid-40s. And so coming back to the upper cervical spine, we've spoken about the bones. The moving out in the layers here, this is the suboccipital musculature, the tiny little muscles at the back of the head. And sometimes people can feel stress in the back of their head. Sometimes they rub these muscles to try and feel a little bit better. What these muscles are, in fact, are not muscles per se, but little joint position sensors. So they are little receptors and little sensors that tell the brain where the head is in space. They provide information and neurological feedback to the nervous system to maintain good head alignment and to keep you upright and to help keep your eyes level on the horizon and to provide information about where your body is in space. And so why that's important is because when there's disturbance in the musculature, when there's disturbance in the upper cervical spine, that all feeds back into the brainstem, into the brain, which can disturb the settings, like basically having a computer that breaks down on you, like mine did last week, and the nervous system no longer fires properly. And so when seeing a massage therapist, I think it's important to see someone who knows exactly what they're doing, because these muscles are very sensitive to input and information. And so when working with the neck and the upper cervical spine, it's important to understand not only the alignment system but also the musculature in how it's helping to keep the body upright. And what meaning how information is coming into the nervous system and keeping itself upright and maintaining posture. When there's problems in either the joints or the bones or in these muscles, it starts creating a lot of problems within the nervous system. And then, as I'll detail later, that starts feeding back into the brainstem and into the jaw and into the face. Your brainstem is the main fuse box for your body. As I mentioned, the C1, C2 atlas axis is very closely associated or wraps around brainstem, and your brainstem is like the fuse box for your whole house. If you open the panel that controls your house, the electrical box, there's a whole bunch of switches in there. lots and lots and lots of different controls that control different areas. One of the main things is your autonomic nervous system, and the autonomic nervous system controls all the natural functions in your body, organs, glands, blood vessels. And so if the main switch is blown there, like the boy falling off the horse, that can create a lot of problems through the body. Your brainstem also has nerves that fire into the eyes via the brain, and that helps control vision. In fact, a quarter of your brain is responsible for vision, so when it comes to problems in visual acuity, it's not always just about the eyes. Oftentimes people remark after getting an upper cervical correction that their vision is greatly improved because that 25% that's of the brain that's controlling the eyes suddenly starts firing better. So that sense of fatigue in the eyes might be related to how your nervous system is working, how the brainstem is working. The brainstem also is responsible for maintaining what's called shunt stability, or the ability to maintain yourself upright. It controls all the tiny little muscles down the sides of your spine, and again tells the body where it is in space and helps you, if you're moving from left to right, it helps contract or relax the different muscles at the appropriate time without you even being aware. And so sometimes if people have upper cervical problems, if they have brain problems, if they have brainstem problems, they might invariably end up with back problems because the shunt stability is lost and those tiny little muscles that are controlling the spine all the way down are not firing in the right way. And so one morning they might bend down to put their sock on and oops, they supposedly blow a disc, or they hurt their back, or something gives way, and you reach around and clench your back and curse your back that you've always had a bad back, but maybe you've actually had a bad brain for a long time, or a bad brainstem, or an upper cervical problem that's been there for a long, long time. Vestibular input means how information is coming from the ears into the brainstem to also help maintain balance and alignment. Then information from the cerebellum, which is this area here, the little brain, which is affected by alcohol, that controls balance and muscle coordination. That also feeds back into the brainstem. And then neck, we mentioned the importance of the suboccipital, I can never pronounce that word quickly enough, suboccipital musculature, coming from the neck, also feeding back into the brainstem. And then information from the limbs comes into the brainstem. So there's so much information coming from so many different areas feeding into the brainstem, and if any one of those switches starts turning off, or a fuse blows, that's like the lights starting to go out in the house one by one. And you might think it's okay at night to go around your house and, one room is out, that's okay, we just won't go into that room today. Or then another room goes out, and that's okay, we'll just live in the kitchen today. It's actually really important for overall health and well-being to have all the lights working all at the same time. And so when it comes to understanding how the body to do in getting a person well, you need to have an understanding of all these different areas and how they might influence how the nervous system is working, how the spine's working. The effects are wide and varied of a upper cervical problem. Concentrational brain fog, I think I mentioned that fatigue in the eyes, or the tiredness, or not being able to process information as quickly as possible. Something I've been seeing a lot in practice at the moment is people being not under stress, because stress is can be misinterpreted. It's exceeding the capacity of your mental processing ability. So when there's too much going on for an individual to handle, for the brain to handle, people start blowing fuses. You might feel like you can handle stress well, you don't feel like you're under stress, but if you've got 100 different things going on in your life at the same time, the ability for the brain to process all of that, kind of like memory or RAM in a computer, it gets overloaded and cannot handle all that information, and so fuses start blowing, whether they're in the spine, in the jaw, in the back, wherever it may be. The brain has blown a fuse and these sort of problems start coming out. Brain fog, poor coordination, that might be related as well to cerebellum and the vestibular system. Difficulty tracking with eye movement, it just seems slow or fatigued. or difficulty focusing. Suddenly people think they need glasses, or it's aging, that kind of thing, but it might be that 25% of the brain that's related to vision. As it relates to the autonomic nervous system, neurological control of heart, lungs, gut, blood pressure, and how your organs are working. Upper cervical problems are a classic indicator for high blood pressure. Invariably, almost anyone I've seen with high blood pressure problems has an upper cervical component to that problem because of how the brainstem is controlling blood volume and controlling the heart. And it's imperative to get the spine checked at the same time as taking blood pressure medication. Looking after someone with those sort of problems needs to be multimodal, multifactorial. It cannot just be one aspect only. Problems in spine and brain can obviously translate into immune deficiencies, increased sensitivity and pain, fatigue, energy loss, dizziness and nausea is also common, photophobia or sensitivity to light, and then because the brainstem communicates with the supraspinal components, meaning areas of the brain above the spine, hypothalamus, pituitary, that can create an array of hormonal problems and emotional disturbance as it translates into the limbic system as well. So, I mean, the effects of problems in the upper cervical spine are quite diverse, and so it's really, really important when people have health issues to cover the full spectrum and to analyze the body as a whole, not just for the practitioner to stare at their computer and write a prescription and say good luck. What is the big deal? Well, I think the effects pointed out on the previous slide outline how important this area is, and the important thing to remember is the difference between structure and function. If you were to take X-rays, if we use X-rays as one piece of the puzzle in assessing someone's function, both of these images on the left and the right would appear normal on X-ray, and the radiologist would report them as normal. However, if you take into account the neurological assessment and try and relate the function or the poor function to what is happening structurally, the right image might make a little bit of sense that there's something not right about this, and that why the individual is experiencing problems, even though nothing is showing up on the MRI or the blood test, there may be something to it as to why this person is not well. And so it's really important to understand what impact the upper cervical spine might have on the function. And we can see that there's a slight, tiny misalignment of atlas on this right-hand picture, and that might impact how brainstem is working, that might impact the suboccipital musculature, that might impact how the nervous system is working as a whole and create problems. As a case example of this and how important it can become, this is a story of a man who flew up from Christchurch to come and see me at the beginning of the year, and we spent a week working together. I spent about 2-3 hours with him every single day. His story kind of started off simply, like a lot of people do, with a head trauma, and some people might recover really quickly from that. That might be luck, or the injury might not have been that bad. But sometimes a change occurs in the upper cervical spine or in the brain that actually blows all the fuses, and it's very difficult to recover from that without the right kind of care. So over an 8-year period, he initially he had a crate fall on his head, hit him on the back of the head, he hit the deck, he was out for about 10 minutes, and came to and went to the A&E, got a couple of stitches, pat on the back, said she'll be right. However, over an 8-year period, all the fuses, all the light switches started to turn off. He started fatiguing, his nervous system started shutting down, and he lost his ability to work. He developed chronic daily headaches. We're talking 8 out of 10, 9 out of 10, 10 out of 10 pain every single day in the head. The nervous system, or the 25% of the brain, controls vision, the upper cervical spine feeds into the brainstem, which controls the eyes as well, and he became so photosensitive he had to wear a hat and sunglasses indoors all the time, and that's how he was when I first met him. Even light, any light stimulus was too much for his brain to process and created headaches and pain. He developed chronic fatigue. Some mornings he couldn't even get up, couldn't even muster the strength to get out of bed. And this was a fit, healthy man, around 50 years of age, who was doing everything a normal 50-year-old would do, enjoying life, gardening, working every day, and this is where his life led after that knock to the head. Loss of strength in his right hand. When he shook my hand when I first met him, it was as weak as anything, absolutely no strength whatsoever. Slowed his mental processing down to the point where he couldn't even make basic calculations anymore because the connections in his brain weren't firing as well. And over that 8-year period, after seeing 25 medical practitioners, they diagnosed him as the problem being psychosomatic. This was very disturbing for him when I first met them, him and his wife, and after the consult I said, I think I might be able to help you. They just burst into tears because they knew it wasn't psychosomatic. He was fine before his hit in the head. Something had changed. And so after a week of working with him and doing a bunch of examinations, neurological workup, upper cervical specific corrections, limb work, we went through a whole bunch of things. He had one headache-free day by the end of that week. He was able to take his sunglasses off. He had a bit more energy. He shook my hand at the end of that week, and he had the strength of a bear. It was just amazing. Everyone was in tears. That's the first time in a long time that I was actually moved to tears. It was just the most amazing thing to see in practice, someone's life coming back online like that. And a couple of months later, I called them up in Christchurch, and apparently he was starting to go for runs in the morning, still just before sunrise because the bright light still affected him slightly, but he was out there and he was doing it, and it's just amazing to see those kind of changes. And so the point is they took x-rays and they took MRIs and everything appeared normal, but functionally something wasn't right. And that's why it's so important to, when people have these odd problems, like you might see orofacial problems or neck problems or head problems, that and nothing is obvious, there's no boogeyman on the x-ray to point at or on the MRI, that it's really important to check the functionality. And that's a photo of him there, that's Will, and that's the hat and sunglasses that he was wearing when I first met him. And I think these electrodes, they're trying to measure something to do with his heart or some kind of function there. So the small changes make for big problems. The effects on the nervous system of a upper cervical misalignment or upper cervical problem can have massive ramifications on the nervous system, just like Will's story there. And this is a really, really simple diagram to show a difference. I mean, it's an obvious difference from side to side of Atlas, the Atlas alignment. As you can see here on the left, that space compared to that space, Atlas is clearly shifted to the left, and on another view it indicates that there's a slight rotation as well. So remember that there's a lot of range of motion available to Atlas and Axis, and so little shifts like this can create a lot of problems within the nervous system as it impacts the brainstem, the cerebellum, and as it fires into the brain. And so what these changes do to the nervous system is that it decreases the rate of firing of the nervous system to the brain. So information coming into the system slows down dramatically. It reduces, because the nervous system controls blood flow, it reduces oxygenation to the brain. So nerve firing and or oxygenation to either side of the brain may become different, and people may develop differences in blood pressure from side to side. They may feel weaker on one side, but essentially the nervous system needs three things to survive. It needs stimulation, it needs oxygenation, and it needs glucose or sugar to survive. And as you start decreasing these factors, then people start having nervous system problems. what a decrease in nerve firing and a decrease in oxygenation does is it affects the muscle activity on one side, and so one side of the neck might become more tight or more flaccid. It might make musculature on one side of the head more tight or more flaccid, and you start getting these distortions within neck and cranium, and that feeds negatively back into the brain and starts creating imbalances in the nervous system, and then people start developing pain syndromes. The sympathetic nervous system, people might recognize that as the fight or flight system. The autonomic nervous system is broken down into two parts, fight or flight, resting or digesting, and the sympathetic is the fight or flight. Now when you have changes in nerve firing rates, when you have changes in oxygenation, that can also change the sympathetic tone. So the nervous system will be in a subconscious state of fight or flight. It'll change the way blood is flowing, it'll change inflammation levels, and it'll cause irritation around those areas of the nerves, cause irritation of the musculature, and people might start developing these one-sided jaw problems, one-sided head and neck problems as it relates to maybe temporalis muscle, masseter muscles, the muscles of mastication for chewing. People might start developing head tilts, and this all, again, negatively feeds back into how the brainstem is working, and fuses start to blow. This picture of the colors, it's what's called a paraspinal thermographic image. So this is some technology that I use in practice to measure temperature from side to side to get a differential of the temperature as it relates to each side of the spine, and to see where potential disturbances might be along the length of the spine. Again, like an X-ray, like any test in isolation doesn't mean anything, but you put all of them together and you start painting a picture. As you put all the pieces of the puzzle together, you start getting a clear image of what might be happening with the individual. And as for this piece of the puzzle, this was another gentleman who came from Australia, and he had about 2 years of chronic head pain after being knocked on the head at work. And the image on the left, the beauty about this particular case and image is that this was like a one-hit wonder miracle, and in such a tiny time frame, 9:47 a.m. to about 45 minutes later, the change and the changes that persisted with him, the great changes that persisted after one correction, was just amazing. The colors up here, red and orange, indicate a lot of disturbance in the upper cervical spine, and after one specific correction to C2, this is the resultant change in how the reduction in sympathetic tone, the reduction in fight-flight activity in that area, normalizing vascular activity, reducing irritation, normalizing muscle tone, normalizing nerve firing, and all of that translates into a happy, healthy brain and a reduction in pain, less headaches, happy, healthy human being. And so, I mean, that outlines the premise of what we do with people to keep them healthy. Why it's important to dentists in the context of head and neck is that these sort of problems, all this red and orange here, creating these sort of problems on one side of the head and face, can create a lot of disturbance in head, neck, jaw, TMJ, and teeth because of the intimate neurological connections, which I'll talk about in just a minute, how they all feed back from the neck through the spinal cord and into the head. And it's part of what's called the tonic neck reflex, which is the righting reflex of the body. The body, like a fish has a swim bladder to keep it upright. If you have a fish tank and you see your fish doing backstroke, that's a bad thing. That means they're going to die. And your body has, your brain and your nervous system has the same capabilities to keep itself upright, to keep you level in the world so you don't walk with your head cocked to one side and constantly falling over as you try and relate your body to gravity. Your nervous system has ways that it keep itself upright, and that's called the tonic neck reflex. It helps maintain postural stability by adjusting all the musculature at the back of the body down the spine, and keeps everything in balance. There was a slide just previously where I spoke about the brainstem and how the brainstem controls the tiny spinal muscles all the way down. That's part of the intrinsic shunt stability that's created in this very, very clever system in the nervous system to keep yourself upright. And if people develop problems in the head or upper cervical spine, that can create a misalignment, for want of a better word, and because of the righting reflex that goes wrong, that can, because the head tilts to a more appropriate situation, the rest of the body tries to compensate and can create problems throughout the rest of the body. That's on a musculoskeletal level, but as we dig a bit deeper, like I've shown you with the connections of the brainstem, that can translate into other problems within the nervous system, within the autonomic nervous system, and can start creating a lot of health problems deep on the inside. The brainstem is part of that autocorrect. Autocorrect is not the medical term, that's just something I've come up with to make it easy for people to understand, kind of like when you're sending a text to someone and it autocorrects. Usually you want to try and get the autocorrect to go to the right word, but sometimes your iPhone chooses otherwise, and the same thing can happen in the nervous system and in the brain. It can autocorrect incorrectly if there's an inherent problem which needs to be corrected or fixed in an appropriate way. The eyes try to maintain the head level on the horizon and maintain normal posture. So if there's a misalignment in the upper cervical spine and the head is tilted to one side, kind of like image 2 here, then the head will, with the brain and the eyes, the body and the head will autocorrect to bring into normal alignment to keep it straight, but that'll have to, the body will have to compensate in other areas, resulting in this kind of posture where you get all sorts of changes throughout the whole system. But in terms of survival value, the body will be, the head will still be upright, the eyes will still be level, and that's ultimately what the nervous system wants, is to be level. It doesn't really care too much about what other changes take place down through the rest of the body. As long as it's upright and you can see where you're going, it's fine. However, that's not a good long-term strategy for the nervous system, because then people start developing other problems, shoulder problems, back problems, hip problems, feet problems, and they go to all sorts of people to try and correct these problems where the aches and pains might be, but that's not necessarily where the problem began. And so that's why it's really, really important to take a holistic view on how all this stuff is working. Maintaining eyes level is part of the tonic neck reflex, and the tonic neck reflex leads to an increased stress response. Why that happens is because as you have distortions in the structure, that then changes nerve firing, that changes oxygenation, causes vascular irritation, changes sympathetic tone, creates the fight-flight within the system, and that's when you get the imbalances and all the problems. Stress response is just a broad term for changes in autonomic nervous system, and you can be aware of that or not aware of it. How someone perceives their stress levels is kind of irrelevant. You know, people often say, "Oh, I handle my stress well," or I've got a high pain threshold. That's another personal favorite. That having a high pain threshold doesn't necessarily mean anything either, because sometimes things are supposed to hurt, and if you've killed enough neurons in the brain and the nervous system that you no longer perceive that pain, that's actually a problem. It doesn't mean you're super awesome because you cannot feel pain or you've got a high pain threshold. It actually might mean that the nervous system is dysfunctional or becoming more dysfunctional. Stress responses, or the tonic neck reflex, then lead to changes in jaw, and this is where we start getting into the meat of potatoes for dentists and dental therapists, because problems in jaw might not have begun in the jaw, and that needs to be a consideration. If you start having problems in TMJ or problems in occlusion, then that's going to feed back into the brainstem and into the brain, and these start reciprocating off each other, bouncing off each other, and suddenly you have this vicious cycle between face, teeth, jaw, neck, and brain, all creating heaps and heaps of problems throughout the whole system, and you don't know where it began if it gets bad enough and left long enough. This is an example of the tonic neck reflex following a traumatic brain injury, how disturbances in the upper cervical spine can create a number of different problems, whether they're musculoskeletal or visceral, organic, or whether they're in the autonomic nervous system, and how it changes orofacial perceptions and creates orofacial pain. So this woman came to see me a couple of years ago. I spoke about her at the Upper Cervical Symposium we had last year, and she was crossing the road and was hit by a vehicle, and she flipped over the bonnet, right shoulder went through the windscreen, and then she hit the deck and was knocked out, went to hospital. I'll talk about this first. These are the some of the injuries she sustained and the repairs that had to be done on the glenohumeral head there, the clavicle. That shoulder was just completely broken and fractured in multiple areas. The bumper hit both tibia and clean fractured through both her legs down at the bottom there, and so obviously had to go through a lot of rehab. And medicine does a great job. Emergency medicine does a great job of repairing people and fixing the structure and getting them back on the road. But then, what's left in the nervous system? What is left in how the nervous system is functioning? If people are still left with problems and you know, a suboptimal human experience because of this, then you know everything's fixed on the inside in terms of structure, but now the nervous system is not working properly, and the experience of life is greatly diminished. And so she came to see me, and this is another example of one piece of the puzzle, a piece of technology I used to measure temperature differential up by atlas, right under the earlobes, in the little hole behind your earlobe, and it can give us an indication of how disturbed the upper neck might be. And your body tries to maintain an even temperature, and if it's a degree above that or below that, 1 degree above might be hyperthermia, 1 degree below might be hypothermia, and that's problematic. And so your body maintains a finite range of about, you know, half a degree, and if it's shifted outside of that, that's an indication that there's problems in the nervous system. And so for her nervous system was so disturbed after all of this, even though she was repaired in a great way, her nervous system was still so disturbed that there was a 0.78 shift to the left in functionality, and obviously that was creating a lot of changes in nervous system firing, oxygenation, sympathetic tone, all of that stuff. And so some of the symptoms she was experiencing after that, because of this shift in nervous system function, changes in facial sensation, changes in sensation over her teeth, left arm pain. A lot of that was related to the injury, of course, but some of that was related to her spine. Left hemisphericity, which means decreased firing of the left hemisphere of the brain, because information coming in from the body was completely warped and distorted, and so the brain stopped firing properly from left to right, and so she started having all these one-sided problems. As we measured the autonomic nervous system, we could see that the pupil on the left was very, very sluggish, just so slow to respond. And then that affected her control of environmental responses to temperature. So because her spine wasn't working properly, because her autonomic nervous system wasn't working properly, she couldn't control her temperature right. And then she developed eczema over her left leg, and that's because the autonomic nervous system is divided in two, like it's got two trees down each side of the body. One side, probably because of that hemisphericity aspect, started developing this eczema on one side. And on top of that, there's always emotional overlay. Post-traumatic stress disorder, you know, when you're hit by a car and have injuries like that, it's obviously going to create some anxiety, and you're going to feel upset about the whole thing. So even though she was patched up and sent out the hospital, these are the problems she was left with, and how do you start to correct that? And so the point of this is that the changes in the nervous system and the changes in the upper cervical spine can easily translate into orofacial problems and present with changes over the teeth and changes in the face and changes in the jaw. And it can change the way that the jaw works. It can change the alignment of the head on atlas. It can change the way that the jaw occludes because of the tensions that are created within the nervous system, the tensions that are created within the soft tissues, specifically the temporalis muscle and the pterygoid muscles. And the temporalis muscle, if there's a change in tone from one side of the body to the other, that can change the alignment of the TMJ joint and can change the way the disc moves within the condyle or over the condyle. And a tight temporalis muscle may pull the condyle backward or posterior. A tight pterygoid on the inside, which might also be taught from stress responses, may pull the disc anterior, and so then we start getting clicking, pain, or just general disturbance around that area. And the tonic neck reflex also creates massive amounts of trigger points through all these muscles, but in particular the masseter muscles, and a lot of people are familiar with those, the muscles of mastication and the tight little golf balls that form in the side of your face that become so painful, maybe after a night of grinding or posturing or tension in the head and face. Sometimes that can just be created automatically from the bottom up, and you're not even aware. A lot of dentists would agree or look at you know, grinding or bruxism as a potential problem for that sort of thing, and obviously that needs to be addressed. But the purpose of this talk is to illustrate issues that might come from unseen areas that you're not aware of. And when people just suddenly wake up one day and they've developed all these problems and they didn't do anything, they don't know where it came from, you know, they're not stressed, what happened, and now they've got all these problems, and what do you do? And sometimes that slow drip-fed disturbance into the nervous system, creating the tonic neck reflex, creating a problematic tonic neck reflex, can create these head and jaw problems and trigger points and clicking jaws and pain in the head and face. That pain feeds back into the TMJ. The disc capsule is the most highly innervated and highly vascularized joint in the body. It only takes 8 pounds of pressure from a boxer with a dip on the chin to knock the person out, because information from the jaw feeds back into the cranial nerve, specifically cranial nerve 5, and into the cerebellum. And the cerebellum lives back here. Remember, that was the area that maintains balance and motor coordination, but it's also an area that interprets a lot of information from the body in terms of maintaining balance from side to side and muscle activity from side to side. And so sometimes when people get knocked out because of a punch to the jaw, that information is actually being fed neurologically from the TMJ straight back into the cerebellum and creates what I call snow TV. And so if you've got snow TV going on in your nervous system, in your TMJ, that's going to start creating problems. And it might lead to more pain, it might lead to changes in the muscle activity, and then clicking, and then more pain, and then pain builds on top of pain, and suddenly people have a chronic condition that no one's able to help them with. The TMJ, it's a small joint, but it gets a very, very big workout. Talking, chewing, yawning, it's moving all the time. And so if a person if their nervous system is under duress, even without them being aware of it, or if they feel, even if they don't feel stressed, sometimes they can, I think in dental world they call it posturing, I might refer to it as bracing, where tensions within the TMJ and clenching can create a lot of neurological disturbance in the TMJ, which feeds back into the brainstem, feeds back into cranial nerve 5, which is the trigeminal nerve. We're going to talk about that next, and that can start changing the level of tone or the ability to perceive pain. Suddenly the individual is highly sensitive to pain because this area is so vascularized and there's so much innervation, there's so many nerve connections that make it all work. That information from TMJ feeds back into cranial nerve 5, which is one of the biggest, if not the biggest, cranial nerve in the brainstem of the 12 cranial nerves. And it's so important and so big that I believe they have conferences just on the trigeminal nerve. And it receives input from the entire face and head, and all information, all neurological information coming from head and face feeds back into the trigeminal nucleus, and the sensory component of that can become highly, highly sensitized to pain. And if there's disturbance from neck, head, or face, it can create or allow that trigeminal nucleus to start brimming at threshold, where it's just buzzing and it's primed and it's ready for anything to tip it over the edge and create pain. And that pain can descend along any tract, whether it's at the back of the head, whether it's in the face, into the ophthalmic division, the maxillary division, or the mandibular division, and people can start experiencing pain shooting out from the trigeminal nucleus along any of these tracts, because this neuron, or these bunch of neurons, are just brimming at threshold. What's most important here in terms of upper cervical is that the trigeminal nucleus actually extends down to C3. In some individuals, the nucleus can extend down to C5. So there's tons and tons of information coming from the neck feeding up into the trigeminal nucleus, also being integrated in this area and feeding out into the face or feeding into the head. So people can have disturbances in any single one of these areas: teeth, face, head, upper spine, lower spine if their trigeminal nucleus extends that far, suboccipital musculature. Remember I said how important those little muscles are. That can feed back into the upper cervical spine, feed back into the neurons that extend down to C1, C3, and then feed back into the trigeminal nucleus. And an analogy to help you understand that is imagine a glass of water. If a happy, healthy nucleus is an empty glass of water, and it starts filling up with stress and negative feedback and tonic neck reflex that's gone wrong, and sympathetic tone and changes in nerve firing, changes in oxygenation rate, eventually that cup starts filling up, filling up, filling up, filling up, and then it's just brimming at threshold. And anything can set it off, whether it's a disturbance in the little muscles, you have a bad day, whether it's disturbance in upper cervical alignment, whether it's disturbance emotionally from the limbic cortex because you have an argument with someone that day, and that feeds back into the trigeminal nucleus. And because the trigeminal nucleus is so important in perceiving head and face pain, and that glass of water is brimming at the surface, it'll just spill over and the person will experience pain. Now it's up to the nervous system and its cracks in the system where that pain might disseminate along and which tract it might disseminate on. You never really know, and that's why it's important to try and look at the whole picture and figure out everything that's going on, from emotional to spine to muscle to head to jaw to teeth, and trying to work out exactly what's going on in the complex cases. In the last week or so, I had a woman come and see me who has had years and years and years of TMJ pain and mandibular pain and pain along her teeth, and she's had multiple root canals now and still has the pain moving through her jaw. And as part of the assessment, I found so many disturbances in her upper cervical spine. And now whether those were the primary cause or whether they become compensations because of problems that began in the head and face, who knows, but now it's just one giant mess that's circulating against itself, and that's what you have to try and clean up. So again, the importance of this talk is to appreciate that the back half of the head is connected to the front half of the head, and the trigeminal nucleus is a massive player in that. It also receives input to make it even more complex, the cerebellum, vestibular system. They all feed back into head and jaw position. And so essentially if jaw alignment, skull alignment, cervical spine alignment are not accurate, not appropriate, that's going to disturb a whole bunch of neurological processes. It's going to fill the cup up in the trigeminal nerve, and it's going to make it brim, it's going to teeter right at the surface there. Any stress from anywhere will make that cup spill over, and the overflowing water will be problems of any description, as related, or as could be seen in any of those previous cases we were just talking about. These reflexes change jaws. So hopefully you have a little appreciation of how complex the nervous system can become in the head and neck, and these problems can create aberrant reflexes because the nervous system, it's brilliant. It responds automatically to things without you having to think about it, and those are called reflexes. And abnormal reflexes create abnormal tonic neck reflex responses, and changes head position and can create dysfunction in the jaw, head or neck, upper cervical spine. And that change in posture can ultimately affect mandibular position or occlusion. And so maybe sometimes people have pure occlusive problems, and that needs to be sorted out at a dentist. But sometimes if these problems are slow and insidious over a long period of time, maybe they've come from the nervous system. Abnormal reflexes from the nervous system over a long period of time have created all these head and neck problems. You know, if you've got enough experience, it's quite easy sometimes to just gently rest your hands on the back of someone's neck or on their shoulders, and you can just feel tension and pain and the amount of concrete that's been poured into some people's trapezius muscles, which are, you know, your shoulder muscles that are holding your head up. You know, a lot of people are struggling. There's a lot of pain. There's a lot of tensions in life that we have to deal with, and all of that adds up into your neck and into your head. And sometimes the jaw is just the tip of the iceberg. You know, it's just had enough of trying to keep itself straight, and then you land up with a jaw like this on this x-ray, and they're just not working properly anymore, and that starts creating teeth problems on one side, and a lot of unhappiness in the individual. So who should you see when you have these kinds of issues? If it's a clear-cut dental problem, then obviously you see a dentist. If it's a clear-cut spinal problem, then you see a chiropractor. But where it starts becoming tricky is that 5–10% of the population where they're not getting much luck from anyone, and they have a whole bunch of head and orofacial issues that are not resolving with either approach on its own. And so who should you see? Well, the answer should be obvious. You should see both. It's not an exclusive either-or situation. It's both and. Health practitioners should work together to solve these sort of issues with people, and that's why it's important having these kind of lectures to make people aware of all the different mechanisms and the possibilities that can lie underneath these problems and how they should be resolved. The reason being is because these problems are intimately connected via the structure, the nervous system, and the automatic reflexes. So if it's a gray area, then look at it as a gray area and think outside the box, and talk to your friends and give someone a call who might have a different point of view on the problem, because it may be upper cervical. Where do these problems start? Well, who knows really. Sometimes they're obvious, but in situations with bruxism, TMJ disorders, trigeminal neuralgia, clicking, jaw deviation, visual disturbances, headache, vertigo, orofacial pain, and they've been chronic for a long time, and the aberrant or negative neurological reflexes are bouncing off each other because it may have started somewhere, but then it ended up somewhere else, and the consequence then reflects back to the beginning, and it's just one vicious cycle. Who do you see? Well, you need to see, as I said, you need to see a number of different people, all with their own particular expertise to try and solve the problem. And this is what a friend of mine in Australia came up with. He's an upper cervical advocate. He's got a great website called upcspine.com, and his life was, he had a medical file that was an inch thick with problems, and you know, years and years of pain and issues. And he's got a fantastic story. He eventually retired and made advocating upper cervical his full-time job. And he made a DVD called The Power of Upper Cervical, so kind of plagiarized that a little bit, but it's you know, the stuff is powerful. And on his website he talks about this total wellness package idea of how to help resolve people's problems and in order that might help. And for starters, getting your head on straight. That's a simple analogy that we use. Making sure that the alignment of atlas and axis is appropriate, the neurological function of brain and brainstem is appropriate. Then checking out a TMJ dentist or a dentist that understands TMJ and addressing alignment issues there or other problems that might be related to head and face. Remedial massage, someone who's qualified, who understands trigger points, who understands musculature and the sensitivity of different muscles, like the upper neck muscles versus the trapezius muscles. I spoke about you know, the pain and concrete that people experience in their neck and shoulders that might have built up over the years. That's you know, you're not going to pray your way out of that one. That needs hands-on. I mean, all of this stuff needs hands-on and resolving people's issues. It's not going to happen by sitting across from your GP and just chatting about it or taking drugs. Sometimes it's hands-on stuff. If the nervous system has become dysfunctional over a long period of time, then there might be a rehab that's required along with that. Exercise, nutrition, those are all the basics. And I would probably add in another dimension there, psychological counseling if it's warranted. Most people, I don't know if I was to make a wild guess of, say, 60 to 70% of patients that I see anyway, there's always some kind of underlying anxiety disorder that's either been at the crux of it or has come as a consequence because of the stress that life and health problems create in our body. And there's always emotional overlay to all these different factors, and it's really important to get your head on straight physically, but also get your head on straight mentally. And so a counselor can do wonders for that. And so anyway, I've dubbed this the wellness wheel because it's a great way to look after the whole picture, and you really need to look after the whole picture appropriately. And so when you know what to do, you can halve your time in misadventurous medical expenditures and get exponential output in results if you're doing the right thing. You just got to know. So it's hands-on, and you need the right gear as well. These are some of the tools that I use in practice. This picture was on the very first slide, and it's an image of a technique in upper cervical. There's a number of different upper cervical techniques. This one's called Blair, and this is a toggle recoil table, a special table for making specific corrections to the upper cervical spine. Obviously, once you've done all the neurological analysis, I mean, my catchphrase of the practice is change your brain, because, and I've got brains everywhere. You can see the brain over there on top of the desk, because the brain is the master control system, and a lot of people in trying to resolve problems just focus on the sore bit, and sometimes the sore bit is not where it's at, and so you need to understand the control mechanisms behind that. And so anyway, where rubber meets road, lying on this table and getting upper cervical corrections is really handy. The kids called this Ferrari, so we dubbed this one here on the left Little Ferrari, and that's for adjusting children, sometimes babies. And interestingly enough, and I just want to digress for 1 second here, is that there's been a lot of negative media at the moment, especially coming out of Australia against chiropractors, pediatric chiropractic. There was a story about a baby's neck being broken, which was, the facts were not correct at all. But because the media loves to sensationalize and haters love to hate, there's been so much backlash and negative social media flooding everyone's blogs, and it's you know, chiropractic practiced by a registered health professional, someone who's done 5 to 7 years of training, who's part of an association, because it's a well-regulated profession that's been around a long time. It's completely safe, and if people know what they're doing and they're doing proper assessments, not just walking in, lying down, having a go, not even knowing their name, if it's done properly, it's a perfectly safe, painless process of becoming well. And so I think it's important for people to do their homework, not listen to just all the naysayers and hearsay and sensationalized media. Understand that chiropractic has come a long way in its understanding of how to help people, and how the nervous system relates to the structure and the reflex and all these things I've spoken about today. And it's just a crying shame that not enough people, or more people, don't know about this sort of stuff, because it's the effects are profound in helping people, and you can read a number of different stories on my website of people getting well, and it's just such a privilege to be a part of that, and I wish more people knew about it, and that not everything needs to be treated by a straight biomedicine. There's lots of options to the individual, and I think it's important that those options stay open, because of this negative media backlash that's going on in Australia. A Queensland politician piped up and said no one should go to chiropractors anymore, children shouldn't go to chiropractors. I mean, a blanket statement like that is just ridiculous. That's like saying you have a bad experience at a dentist or a bad experience at a GP and you're never going to go to a GP or a dentist again. It's just absolutely crazy. Not all chiropractors are created equal, not all patients are created equal, not all doctors are created equal, not all techniques are created equal, and definitely not all brains are created equal. So the bottom line is you need to go to someone who you can trust, who knows what they're doing, and in the hands of a registered professional, totally safe and a lot of fun, and the benefits are well worth it. And so finally, get your head on straight. It's a great place to start. You need your head on straight in order for the whole body to work properly, for information to go appropriately from brain through to body, to pass through the gateway, which is atlas and axis, through the brainstem, which is your main fuse box here, and understanding the difference between structure and function. Structurally, this one on the right here looks normal, seems fine, but functionally that person's quality of life is greatly diminished, and getting your head on straight may be a great start. If anyone has any questions, they're welcome to email me, Neil at Spinewave, or you can give the practice a call. You can email through the website.